Pressure's mounting on the Prime Minister to enable more care home visits to improve the welfare of residents.
Well, we're joined now by Care Minister Helen Whately. Good morning to you, Helen. Thanks for joining us. Mounting pressure for residents to be able to see their loved ones. When do you think this will happen? Now that we've heard about the good news with 2/3, fall in infection rate, surely now, care homes need to be making provisions to let those relatives back in so that they can see their loved ones who they've been missing for months.
Good morning, and really good to speak to you this morning. I absolutely want to see more relatives, loved ones reunited with those who are living in care homes. And I know that those running and working in care homes want to see exactly the same thing. I mean, just to be clear, at the moment, we have put in place guidance to try and make sure that some care home visits can continue. But at the moment, you can't do normal indoor visiting. We're saying that if you visit, there should be a screen or should be in a visiting pod, or if it has to be through a window. But what we really want to do, and I really want to do, as we can open up and as we begin to move out of this lockdown, to enable more visiting so people can go back to spending time more like normal with their family members in care homes, and be able to do that holding hands again.
Contact is, what everyone wants with their loved ones. So if a wife living in a house has been vaccinated and her husband living in a care home has also been vaccinated, is there no reason why they shouldn't be able to be in each other's presence and actually break social distancing?
Well, clearly, we're making huge progress with the vaccination programme. Nearly 16 million people vaccinated, and over 90% of residents in care homes who can be vaccinated have been. But remember, that's still the first dose, and still takes a little while for people to build up the immunity, and then they need the second dose. So quite separate from that, I want to enable visiting to start again. But for instance, to use things like testing and PPE and those kind of measures to make sure that it's as safe as possible.
And the thing is, it's so difficult, isn't it, for those families who haven't been able to see each other, have those contact visits for so long. Some people haven't been able to do that for a year now, and it's heartbreaking for those families that are in those situations. And some residents are there in extremely vulnerable circumstances and greatly rely on those family visits. Shouldn't the government be doing more now to help care homes who aren't able to make those visits work?
As I said, we've got the guidance already that allows visiting, for instance, with screens. And something we particularly have done over the last few months is provide extra funding to social care and through to care homes so that they can invest in some of those facilities. But I do know, and I've heard particularly, for instance, talking to family members of somebody with dementia in a care home, that it doesn't always work to have a visit through a screen. It can be really confusing. What they really want is, for instance, to be able to have some contact, for instance, hold hands. And that's why we want to move beyond that and, for instance, use testing, but still with PPE. We're still going to have to be careful. I mean, we can't get away from the fact that those living in care homes have been at greatest risk from this disease. Of course,
and we want to make sure that they're protected, but also they're at a huge risk, aren't they, of the damage to their health, their well-being, their state of mind by not being able to see family members. Can we expect further details from Boris Johnson on this? Is there going to be an announcement? Because, there are those people who are saying, actually, with vaccination, with the testing capabilities that we have, with the PPE that we have, there should be a way for more visits, closer contact visits, to be able to be facilitated in care homes.
So absolutely, I want there to be more news on this in the plans for the coming out of lockdown, which the Prime Minister is going to set out next week. And to do that, of how we can step by step get back to more like normal visiting. Because as you say, it's the thing for many people living in a care home. That's the thing that makes life really worth living, is to be able to see their family members. And actually, it's really important for those family members. I've spoken to the wife of somebody living in a care home who hadn't been able to see her husband for a really long time. They want to be back together, and I really want to try and make that happen.
Should it be a requirement for care workers to be vaccinated if they want to continue to do their job? Some are choosing not to have the jab, which is ultimately putting others at risk. I mean, this feels very uncomfortable.
Well, it's really important for our health and social care workforce to get vaccinated. And there was a good reason why JCVI put not only care home residents at the top of the list, but also care home workers, and then healthcare workers as well have been part of that first 4 cohorts to be offered the vaccine by the 15th of February. We are seeing really strong take-up of that. And one of the things we're seeing is as vaccination teams go back round to the care homes to vaccinate people who couldn't be vaccinated the first time around, for instance, if they were COVID positive at that time, then we're seeing more staff coming forward and getting vaccinated.
What are the figures
day by day, we are seeing the numbers go up here.
Sorry to interrupt. What are the figures on that now? Because we were hearing the vaccine take-up among care workers, up to 1 in 5 care home staff had refused the vaccine. That was research shown in January. So what's that figure looking like now?
So the Secretary of State said, the Health Secretary said earlier this week on Monday, we've seen around 80% of the NHS workforce vaccinated and more than 2/3 of those working in care homes. And I expect there to be more data published as part of the general publication of vaccination data.
So a third of those working in care homes haven't had the vaccination?
So what the Health Secretary shared on Monday was about 2/3 who had, therefore a third who had yet to have it. But as I said, for instance, understand that there will have been people the first time round who may have been within 28 days of a positive test. There'll have been other care home workers who, for instance, were not on the shift when the vaccination team came round. So that's why we're seeing, as the teams go back in again to care homes, more care workers getting vaccinated day by day.
So there's still some work to do, Helen.
Yes, absolutely. And, it's really important. I would say to any of your viewers who work in health or social care, if you haven't had your vaccination, please do come forward, get vaccinated, whether it's in your workplace, whether it's contacting the National Booking Line or through your GP, come forward, get vaccinated. That's one of the things you can do to protect those you look after and yourself.
But the research seems to suggest that it's not just people who were perhaps, not on shift or were not or were affected by coronavirus at the time, so couldn't have it. But there seems to be health fears, cultural factors. That's coming from the research that was done as to why people were refusing to have it. So actually, there's quite a lot that needs to be addressed here, isn't it? It's not just a logistical issue of they weren't in at the time or they were ill so couldn't have it.
You're absolutely right. It's not just that. No, part of the important thing is to make it as easy as possible and as I was describing, go back into the care homes. But some of it is to address the concerns that, even fears that we know that a small number of people being offered the vaccine have. What I've heard, for instance, talking to care workers, is they say, no, it's colleagues working together on this. Seeing a colleagues and seeing residents you look after being vaccinated, that makes a real difference for somebody who might be a bit nervous to be reassured, yes, the vaccine's safe, yes, it's absolutely fine, and to go ahead and to get it.
Robert Buckland, the Justice Secretary, had been talking about the possibility, we mentioned it earlier, that employers may be able to draw up contracts for new staff saying they had to have a vaccine. So could you envisage bringing this in, no jab, no job, in the social care sector, bearing in mind then we've got that big number, the significant number of people who are working in care homes who haven't been vaccinated, potentially putting residents at risk?
Well, we know that some employers are looking at this, and some care homes, for instance, are looking at saying that for new recruits to their workforce that they should be vaccinated. But what I'll say is a government policy on this is for us to make sure people can access the vaccination as easy as possible and have all the information that they need to be reassured in the event that they're worried about it, to know that it's safe and it's the right thing to do.
OK, and one thing, we've just been talking about summer holidays and whether people should be thinking about booking them now. Obviously, everybody's keen for lockdown to be lifted, aren't they? We're all looking ahead to when that might happen. We've got the good news today on infections falling. There are those people who are saying, in light of those numbers, in light of the fact that the vaccination programme is going so successfully at the moment, that actually we should be looking ahead to lifting up the lockdown more swiftly than is being suggested.
What I'd say is just, we need to be a bit patient. So we're seeing really good data coming through clearly on the rates coming right down. Though I should remind viewers that we've still got over 20,000 patients in hospital with COVID. On Saturday alone, we had over 1,000 new admissions with COVID. So people are still catching it and still being hospitalised. So we need to take this step by step. But on Monday, the Prime Minister is going to set out the roadmap for coming out of this, and we'll see more information then about the steps that we're going to be able to take to ease the restrictions and get back more towards normal.
And are you confident that schools will go back smoothly on Monday, the 8th of March?
Yeah, because we're hearing this morning COVID spreading most in children, as despite the overall infections showing that reduction, that actually it's primary-age children and young people where the virus is spreading most quickly at the moment.
As you'll know, we really want to get schools back. We were so reluctant to close them. They was the last thing to close, and we've said we want them to be the first thing to open. I mean, I know as a parent, I've got 3 children homeschooling at home, how it's far from easy for the parents. And even though teachers are doing a great job at supporting online learning, it's just not the same as children being in school. That's where children should be. So we want to be able to open up schools as of the 8th of March. But the Prime Minister will set out more on this next week as part of the roadmap.
OK, well, thanks very much for your time this morning. That's the Care Minister, Helen Whately.
Thank you.